If you're watching this video, that means you probably had some retainers at some point, and for some reason you stopped wearing them for a few days, weeks, months, I hope not years.
Hello, I'm Dr. William Park with Bless Smile and Smile on You Dentistry.
In this video, I'm going to tell you what to do if you haven't worn your retainers in a while. There are 3 things that we can do if you have not worn your retainers in quite a while and they are not fitting as they should. Let's go with number 1. Say you're trying to put your retainers in and it's hurting a lot, it's super tight, but you can get it in well enough. Let's say we're like 80% of the way there, it's just really tight when you're putting it in. What we usually tell our patients is that if you can get it in about 80% of the way, try to wear it for at least 3 weeks, 24/7. So pretty much all the time for the first 3 weeks. You would only take it out when you're eating, brushing, or flossing, so you will have it in for most of the time for those first 3 weeks. With time, the teeth will slowly shift back into place. The next day it will be slightly better, a little bit less sore, maybe a little bit better the next day after that. And then a few weeks later, you should be able to put in your retainer without any pain and any tightness. But remember that for the first couple days, the teeth will feel pretty sore and tender. It's going to feel like when you got your braces first on. So first, try to see if you can fit it in a majority of the way. And if you can get it in, try to keep those on 24/7 for those first 3 weeks. Option number 2, you are trying to put the retainer in, but it's nowhere close to fitting. If there's just no chance for that retainer to get down and sit around your teeth, then you may have to go to your dentist or orthodontist office to get a new retainer made. If the teeth have shifted enough that you can't get the retainer in, but it's pretty minor and you're still happy with how straight your teeth are, and you really don't care about the little tiny bit of shifting that has happened, then you can just get a new retainer made for how your teeth are aligned now, and that will at least keep things from shifting any more than it already has. But if you just decide, hey, I'm done with my retainers, it's not fitting, I just don't want to get a new one, then your teeth will keep on shifting over time, and then after a few months, years, however long, you are going to want to get things straightened up again. Which leads me to the 3rd option. If the teeth have shifted so much, they're just way off, you just can't get your retainer in, and you're not really happy about how things are looking anymore because things have shifted around so much. In that case, you may need to get some orthodontic treatment again, whether that involves some traditional braces or with Invisalign. Well, there you have it. Those are the 3 things that you can do if you haven't worn your retainer in a while. Number 1, you can try to force it in if it's not too tight and you can get it in a majority of the way. Number 2, if things have just shifted way too much that you can't get that retainer in, but you're happy with how things are looking, then you should get a new retainer made. And lastly, number 3, if things have just shifted way too much and you just want things to get straightened again, then you may want to look into doing some orthodontic treatment again. So again, it was Dr. William Park with Bless Smile and Smile on You Dentistry. Leave me a question or comment down below. Let me know why you haven't worn your retainer in a while and what you decided to do about it. I want to know and I want to see what you guys are thinking. If you found this content helpful, make sure to subscribe to our channel so we can continue to make content like this. If you're in the Los Angeles or Orange County area, we would love to have you come into our office for a consultation. You can find us at smileonyoudentistry.com. Thank you for watching.